McNamara. And Minister, I'm on record for saying I think you're taking a hands-on approach, and I welcome that. But that hands-on approach must be within a context of recognition of what you've inherited and where we are with mental health. And so we have the mental health reform submission that I'm sure you're very aware of and was already referred to. We have the Ombudsman Commission's report in relation to it. And we have quite extraordinary, a lot of articles in the national and daily papers telling us the situation in relation to mental health. The one that really left an impression on me was a therapist who's carrying out working as a therapist for a number of years. She said, we must confront the painful truth that we are facing into a mental health crisis. I've never known my work and myself to be so ineffective. I won't name her. She was in the national papers. That was also carried by an article by Patrick Frayne. So let me go to what matters. We have any amount of documents. 1984, in a different life, I was very familiar with it and foolishly was hopeful when the planning for the future, and I worked as a psychologist, that we were moving in the right direction. Unfortunately, it was never implemented. That was followed by Vision for Change. That was very badly implemented, partly. We didn't need another document. Then we had an update of literature, and then finally we got Sharing the Vision. So what we've really got is a constant change of language and no implementation. Now, the Ombudsman's report and the report is actually frightening in relation to mental health. The Ombudsman points out that we've the 4th highest suicide rate for teenagers in the EU OECD region, and 2,300 children waiting for an appointment to CAMHS, and all of the other figures that have been mentioned. I have 1 minute left. I don't wish to quote figures. They're at pandemic levels. But what's awfully important here is the Independent Monitoring Commission. Now, I know you've made progress, and I've taken the trouble of reading the minutes. And I have to say, I don't wish to be negative, but I have to say, first of all, well done. You've pushed to set up that independent. But I worry about its independence. I worry about the gender breakdown. I worry that the health executive is very much represented on it. And how will it function as an independent monitoring commission? Also, the chair of the Mental Health Commission is on it, who has done tremendous work for the mental health when they visit. But there are serious questions here about independence and about the ability of that to monitor the 3rd document we've got, Sharing the Vision. I wish I could go on, but I won't. Thank you, Minister.